Good evening, everyone. I'd like to call the Community Mental Health Board meeting to order. And I'll begin by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next is adoption of the agenda. All right, motion by O'Connell, support by Bush. Any discussion? All in favor signify by saying aye. Aye. Opposed? The agenda is adopted. Next is hearing of the public. This is an opportunity for any members of the public to address this board. You have 5 minutes to speak. Anyone from the public? Seeing no one from the public, we will move on to item number 5, which is approval of the minutes of the regular meeting of the board that was held on September 25. Motion by Phillips, supported by Schmidt? By Burke. Any discussion on the minutes? All in favor signify by saying aye. Aye. Opposed? The minutes are approved. Next is item number 6, approval of the Standing Committee meeting minutes of Recipient Rights Advisory Committee that was held on October 3. Need a motion to approve by Seer Matero? Support by Schmidt. Any discussion on those minutes?
That presentation was a very good presentation of the site visits, but as I stated in the meeting, I think we should have another meeting to discuss how we can assist on some of the issues that were brought up in the site visits.
I agree. And I thank you for bringing that up, and we'll have to, Dave might not know what we're referring to because he wasn't at that meeting, but we will, bring him up to speed. Were you there?
When Nick says he was going to bring in the Attorney General, David was there. The recipient rights presentation.
Oh.
Regarding the home visits?
Yes.
Okay, so Brian just doesn't want that issue to fade away.
We can meet on that, instead of meeting, to simply meet on that and have a discussion about it.
All right. And you will
Yep.
work on that? Thank you. Anyone else? Any other discussion? All in favor of approving the minutes signify by saying aye.
Aye.
Opposed? Minutes are approved. Next is item 6B, the minutes of the Program and Budget Committee that was held on October 9. Motion by Kraft. Support by Fantuzzi. Any questions, discussion? All in favor signify by saying aye.
Aye.
Opposed? The minutes of that meeting are approved. Next is item number 7. And there's items A through D that were discussed and voted on to forward to this meeting. These were all discussed at the Program and Budget meeting. Approve all 4?
There we go.
All right.
Support.
I knew there was a word in there.
Motion by McGovern, supported by Burke. Any discussion on any of those? All in favor signify by saying aye.
Aye.
Opposed? All the requests have been approved. Next is item 8C, receive and file the marketing and communication strategy, which we also heard a presentation on that at our last meeting. So just a motion to receive and file.
Move to receive and file.
Motion by Bush,
Support.
support by Fantuzzi. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Are there any resolutions? No resolutions. Item number 10 is the voucher listings. We need permission, the department needs permission to pay the bills.
Support.
Motion by Schmidt, supported by Phillips. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is the management report.
Got to me quickly. Good evening, everybody. Just before I always tend to forget the announcements of our schedule. So on Friday, November 1st, 7:30 a.m. is the Policy and Legislative Affairs Committee. The next Program and Budget Committee is Wednesday, November 13th at 6 p.m. The November full board meeting is Tuesday, November 19th at 6. And the Recipient Rights Appeal Committee is to be scheduled. Also, I have notes here for save the dates. The State of the County is scheduled for Wednesday, December 4th. And the Macomb County Community Mental Health Holiday Open House is scheduled for Thursday, December 12th. I don't have times for those save the dates, so we'll get those out to you. Also in your packet as a handout was the article from Cranes announcing the end of the infamous 298 pilots. Those were the 3 regions in the state that were scheduled to do integrated healthcare pilots, the Medicaid dollars going to the Medicaid health plans. Most recently, the start date had been pushed back, but in the budget process, the whole process was terminated and eliminated. There's differing points of view as to whether or not that's good news or bad news. Personally, it was giving us a little bit of breathing room, in my opinion, that the state was looking at whether or not these integrated healthcare pilots could work. And while they were working on that, we had time to look at how things were going in Macomb County. With those off the table, it leaves the state open for other models of integration. They are talking, and there are some public meetings coming up about the redesign at the state level. So they are talking about eliminating the Behavioral Health Developmental Disabilities Administration and putting it under the Medical Services Administration at the state level. And they are looking at other states' models of integration. That's all we know. When we ask, why are you looking at those? What do you want Michigan to look like? What outcomes, what's your desired outcome of these changes? We don't get any response back at the state level. At the PIHP level, that's kind of a consistent message now is, can you please tell us what you want this new system to look like? And should not be change for the sake of change. What is it that you're looking for? To date, we don't have any response. Nick?
Yeah, if I could just add to that a little bit, because you weren't at the conference, for the members who weren't at the conference, for members who were there, know this. Director Gordon expounded on some of that in his remarks and met privately with several different groups, including the parents. What's the name of your committee? Person Served Advisory Council that was just newly created. He indicated in his remarks that, one, obviously reminded us of the veto by the governor, and two, that the governor has now announced, as you pointed out, that it doesn't go back on the table. The legislators who were present at the conference indicated they didn't see it coming back, 298, in that form. And that was a bipartisan group, 2 Democrats, 2 Republicans. 1 House member, or 2 House members and 2 Senate members. Thirdly, they intended to look to ways to integrate from several different sources. That is, looking at what other states have done, and I thought it was significant that he made a specific point of indicating that the other states that had gone down the road we were going down on 298 with were ones that had failed, and that one of the reasons for vetoing 298 was that he didn't see any chance of reaching reconciliation, I think is the term he used, between the various stakeholders, and made a major point of indicating that while within the next couple of weeks they intend to be announcing some sort of process, that process is supposed to be very open. Whether it will or not, obviously, we'll have to wait and see, but at least from the remarks he made to the CMH board and from the comments he's made to a number of our members and to Bob Sheehan, I thought it was very encouraging that we all were for integration. We just didn't like the way they were trying to integrate. The other point I just wanted to add, if I could, you commented on a proposal that's floating around to put behavioral health in under Medicaid. Actually, I had asked that question at the Metro region about the lack of coordination between Medicaid and behavioral health, and Bob Sheehan, our executive director, reported, one, that there needed to be talking between the two, but that the state association was had immediately come out in opposition to that particular approach. And I agree, I think we get lost in the shuffle because Medicaid, while it's 95% of us, we aren't 95% of Medicaid. Medicaid deals with all the physical health issues as well.
I think I had mentioned in a previous report as well, the state licensing was coming out looking to make some changes to the licensed professional counselor, pretty much eliminating their ability to make a diagnosis. That would have impacted our ability to, in the way we utilize staff, and would have caused problems statewide. There's already a shortage of mental health professionals. So that was successful, and that was overturned. They're keeping that, they're keeping the counselors the way they were previously. And as a licensed professional counselor, I thought that was helpful. The Department of Health and Human Services Subcommittee, they're holding a series of mental health hearings. Representative Mary Whiteford has announced a series of these hearings October 2nd through November 6th. All the hearings will be from 10:30 till noon in room 352. That's the House Appropriations Room, third floor of the Capitol. And Wednesday, October 23rd, today, the case for behavioral health integration from the former Medicaid director of Arizona, Thomas Betlach, Betlach. He's the former Arizona Medicaid director. So I know Arizona's come up a number of times. I'm going to try to find some time to do some internet searches and see exactly what's going on in Arizona. The next one is October 30th for public input, and then Wednesday, November 6th. So, yeah, you have to pre-register. And I know some people who were attending today, so hopefully I'll be able to get some of those updates to the board. Just earlier today, I presented in this room to the Board of Commissioners on our budget. The community mental health was fourth in the presentation, which I think helped me a little bit.
You're all tired by then.
I'm not making any additional comments. I'm just saying that. So again, they're looking at the budget we submitted for this current fiscal year without having any of the already information on the changes that have made. So I did touch base that I do anticipate an amended budget being put forth back through this board and then to the Board of Commissioners based on the Medicaid capitation rates that came out. We are projecting increased revenue, which is good. The Community Mental Health Association of Michigan did some rough projections, and they broke it down by region. It was $18 million additional funding for Macomb. Some of that, about $3-4 million, was children's waiver, which previously was a fee-for-service arrangement. They put that money into our capitation, so that brings it to about 15 million in actual new money. They've acknowledged some of that's earmarked for autism specific, because it's just obvious that that area was underfunded. But it does acknowledge, the state's acknowledged that the community mental health system statewide was underfunded. You know, a little too late kind of thing, but, and it's not enough to put us back to where we were, but it's, you know, kind of a welcome relief, and it sure beats a funding reduction. So we're happy for that. As soon as we get some better data and projections, we haven't even received the first funding file for this fiscal year yet. So we'll have to kind of see what those projections, how they pan out. Nick, I had your email about following up with Director Gordon about his lack of information on the historic reductions to Macomb County. Thank you for following up with him on that.
If I could,
Sure.
yeah, I was just going to tell you, I talked with him shortly after his presentation, because quite frankly, when Bob Sheehan told us that at the Metro meeting, I think that's where it was, well, somewhere along the line, somebody told us that. I was shocked that he hadn't been aware of it, considering all the communications that's gone in and out of the department and the legislature and the governor's office and everyone else. He said, yeah, he had heard about it the night before, and that he was going to talk with us later. And I think that's a good, I also suggested to him that to avoid the problem in the future, the CMHs ought to be, and the PIHPs particularly, ought to be involved in the discussion in the development of the actuarially sound rates, and that the rates ought to come before we're asked to sign the contract.
Mm-hmm.
He didn't make any commitment, but I
Right.
thought he might as well take the opportunity
Those
to put
were
it this
welcome
year.
comments, yes, thank you. And it would, just on the paperwork side, you know, we're submitting these budgets, and then we have to make all of these adjustments because we don't know what our rates are going to be until after our budget has been submitted. And I know I'm probably forgetting some comment. Oh, I did have, just before I came over to this meeting, I sent an email to the board members. It was information from Alan Bolter, and there were 3 attachments. One of them was a presentation that the CMH Association did to the House of Representatives, and I had made some edits to that, pretty much just whittled it down a bit, and I was prepared to share some of that with the Board of Commissioners. I was losing their interest already, so I cut that short, but I will be emailing them this presentation, and I'll be sending it out to board members here as well. And I did make a comment at the Commissioners that we did serve 16,737 unique people last fiscal year. Wow. Data's still coming in. We haven't closed out the fiscal year. That was a total of 1.78 million services, which are units. So some of our units are a 15-minute unit. So you could have 96 units of something in one day, which accounts for some of those numbers. Some of ours are an encounter, which has no set time. Some are an hour, some are a day. And that was from one of our new AFIA data reports. And I will leave it at that. Thank you.
Thank you. Are there any other agenda items from members of this board? Phil?
Thank you, Madam Chair. I just wanted to let this body know that last week at full board, the Board of Commissioners did approve $18,000 for Richard Carpenter's contract. So if you have a commissioner, which you all do, maybe you should call them and thank them. The county executive refused to chip in, so the county commissioners went half and half with CMH. So just wanted to let the board know that. And I wanted to also thank Tracy and Cindy from Finance. In Dave's absence, they were extremely helpful because some commissioners had questions leading into the board meeting, and they were super helpful in getting that mission accomplished. So thank you, Madam Chair.
Well, thank you, Phil, for all of your work. I realize there are many other people involved in it as well, but you were our point person at the board meeting. I appreciate it. Selena.
Adam or Dave, at the conference, some of us attended what we thought was talking about face-to-face assessments and how some of the counties are, moving towards it. And the adolescent face-to-face in the emergency rooms is very well received. It's working out really, really well. I haven't spoken to any emergency room that has complaints over it. But perhaps you guys can comment a little bit, because a lot of questions came up when we attended, and Greg Sendy from New Oakland proceeded to discuss how they've entered into a contract with Macomb County for the adult side. So maybe you guys can update everybody that's not as familiar with this, because we've been hearing it for several months, about how we will be doing face-to-faces for the adults to decrease that inpatient admission. The stats that Greg Sendy was giving were phenomenal, but not everybody understands it. So maybe you guys can touch bases on that.
I'll start.
Could you start by telling us what is meant by face-to-face?
Yeah.
Okay.
Actually, it's a double meaning. New Oakland actually calls their program the face-to-face. But what's in Selena's comments, it involves going out in person. So they're sending out a master's level clinician to complete a screening and assessment of the person prior to see whether or not they require inpatient hospitalization. For a period of time before this, Macomb County was doing everything telephonically. So people were presenting in an emergency department. The emergency department staff were calling our access center staff and giving them information. What the outcomes of that were, about 70% of the people who presented were being hospitalized. I worked with New Oakland in Wayne County, and our numbers were the opposite of that. So we were able to divert 70% of the people who presented in crisis. That's a value add across the board. From the business aspect, you're saving money on the inpatient episode. Our typical length of stay, 6-7 days. We know what our hospital daily rate is. We can easily identify that cost. So now by having New Oakland go out, we can divert people, keep them in the community, which is typically better for the individual, and have them go to a more community-based level of care. So we have crisis residential, we have partial hospital programs, we have our assertive community treatment or ACT programs. New Oakland will now provide intensive crisis stabilization, which is a specific Medicaid covered service that has a lot of requirements that goes to it. They have to follow up. They have to have a psychiatrist as part of their team. So they'll provide those services to help keep the person stable in the community as much as possible for as long as possible. Some of the folks could be diverted just back to their regular outpatient provider. So I present, and I've kind of calmed down by the time they come out. They can just say, okay, why don't you just follow up with your therapist or your psychiatrist, at ABC provider tomorrow. So we added the intensive crisis stabilization service to their contract, clarified the hospital screening part. If the person does need to go into the hospital, they will find a bed. And we are also piloting the open bed software with the state. Those meetings are currently ongoing. If the person needs to be hospitalized and we cannot locate a bed, that happens frequently, and that's part of why this open beds project is in place. New Oakland will go out once every 24 hours and rescreen the person to see if they could be diverted at that time. So again, historically, they would do a telephonic, they would say, yep, Dave needs to be hospitalized, and they would work 3, 4, 5 days on finding a hospital bed for me and then transfer me. Well, things change, over time. So that's another reason that leads to the increase in our number of people that can be diverted. It also increases our presence with our healthcare partners in the community because we're out there face to face. We're not just leaving this person with the appearance of, well, it's your responsibility, call us if anything changes. We're out there, we're being more proactive, we're meeting with the families, explaining our services, what's available in the community, working with the hospital treatment teams, and it kind of builds with time. What we saw with the children's side, which is currently being performed by our staff, was pretty much a 10% increase in diversions every month for the first 4 months, and we hit 70% diversion within 4 months of starting that face-to-face screening. So it's a value add, it's a good service. There will be some bumps in the road, and we need to work with everybody involved. Also, there's, how do you contact, who do you contact for different people at different times? We're trying to streamline all of that so we have a consistent message out to everybody, our community stakeholders and our healthcare partners.
Dave, is this the same thing, this face-to-face, as the ROC program you described a few meetings back?
Yes, we were doing the mobile crisis ROC for this. So it's moving forward. New Oakland has requested to kind of roll it out emergency room by emergency room, was the update I got when I came back. Adam, do you want to add anything? Or?
So as we started digging into this, a lot of different components came up, which I didn't really think about in the beginning. So as we met, it started to unfold, and we were dealing with the little pieces as they came up. We wanted to see what the volume would be, because New Oakland didn't have an idea of the volume, and as we got into some of the AFIA dashboards, which we had to go back to AFIA and find the right dashboards, so all these little components, like I said, would come up. We got a better idea of the volume. We met with Greg and Kevin and their team last week to talk about some of that volume, and then how they're going to meet those needs within the community, if they're going to stage someone at a hospital, if they'll be close, how many staff they'll need. So that's what we're looking at now, which is what Dave mentioned about possibly the phased roll-in, because they want to do as many face-to-face screens as possible, with the emergency little outlet being a phone screen if they don't have anybody in the community to respond at that time, and then what it takes for their staff to, for them to come up to staffing, the hiring that they would have to do and the training that they would have to do. Some other little pieces that we worked with when we were building this out was like getting everyone access to our focus system, getting them trained on our certificate of need. They've had, I think, 2 or 3 trainings now on our certificate of need, so their staff are ready to utilize that form. So it's been a lot of building, a lot of coordination. New Oakland's been a great partner in this. Our team has been excellent in this. So it's been a lot of work, but we're very close. So that's what Dave and I discussed earlier.
Do you anticipate then moving the adolescent portion at some point, maybe transitioning it to New Oakland?
That's possible, yes.
Well, with that being said, what happens to our staff at the Access Center? Because that was a big chunk of what they did during the day, is that screening with the emergency rooms. Are you going to be moving them into like something else? Because now that's kind of...
It wasn't Access Center staff. The Access Center staff will continue to do the utilization reviews.
Okay, the CSRs.
Right. Currently, the children's crisis screening is being done through our children's department from the Verkulen building.
Okay.
And they had existing rules. We didn't add anybody to do these screenings. So if that did at some point in the future, there's no set date or plans. we're keep New Oakland busy with the adults. But we'll be able to do some comparison and, share best practice.
I think the adolescent piece works really well because who's coming out to screen?
They know the children.
These children, they know these families.
Right.
And so immediately there's a bond that they can assist in the families and the child feels safe. And so that's the reason I'm asking is because it's working so well.
Right. Yeah, and if it's not broke, don't fix it.
It-
Yeah, so when we were first talking about rolling this out, I was looking at New Oakland doing adults and children. In a crisis, you don't want any ambiguity, uncertainty, between the hours of, Monday through Friday, I call this number, Saturdays and Sundays, or for, somebody's 17 or today's their birthday, who do I call? You don't want that type of confusion, so it's easier to go through one number. But with the RFIs that we're going to be issuing for the call center, we can do that telephone triage, so we can give the community a single number. If you're having a crisis, call this crisis line. They will be able to then trigger the appropriate team to go out and do the face-to-face. So I can get what I wanted and still have more than one team out in the community.
Thank you.
And if I could, to touch back on Phil's comment about the Richard Carpenter contract, I did see the emails when I came back. His agreement was modified, so the 5% increase would take place January of 2021. And that was one of the questions from this board. I just wanted to make sure that that was clarified as well.
Anyone else? Tony?
I bumped into something very interesting, and Linda has also shared a little workshop time to go back and why I was interested in it. I visit with our legislators in my town, Peter Lucido and Doug Wozniak. And Lucido was talking about monies that were requested for other things, not disabilities, but whatever the subject was. He said there is no more money in the state of Michigan because everything that they're doing is so strongly focused on roads right now. So that's a big barrier, and that was mentioned a couple of times during our conference. But what Lucido said is that if you guys want any kind of monies, one of your best bets is going to be a millage. Now, before you throw up on the table, there are 4 counties in our state that have succeeded in getting a millage that supports their CMH. And that's Ogemaw, Washtenaw County, which has got Ann Arbor and Ypsilanti in it, and Jackson, which is well-known, lots of people there, and so is Hillsdale. 4 counties have succeeded in getting a millage approved by their residents, overwhelmingly, like more than 75%. And I bring that up to you because I think there might be a point in time that our board may have to look at that as a possibility. Now, in their cases, it took them like 3 years to get it going. And there are many pitfalls that you cannot list as targets for your spending. Most of the spending goes to general fund, and general funds can do things that don't compete with Medicaid or some of the other obligations we have, but because it can relieve some of the things that we're winding up buying right now, it might be something we well need to look at. And Linda and I had attended the first session, but I wound up attending the second one with Washtenaw County had explained the pitfalls and why they promote it the way they did, that they had an attorney involved in finding it out, and the success of this thing was just stunning. And I kept their handouts, and Linda's got a stack. So at some point in time, we may be talking about that. Wanted to bring that up to the board.
Thank you. And I'm sure one of the things you learned there is if that were ever something to go on the ballot, that's a decision that the Board of Commissioners makes, not this board. Yeah.
That has been very clearly stated. It's a Board of Commissioners function.
All right, any other? Yes, Linda.
I have a handout. The workshops were excellent again this year. I think everybody who went really got a lot of information that'll help us in the coming year. But I have a handout on social determinants of care, and it's so interesting to me, and I think a lot of people who don't come from the paradigm of social work or health care, that this is kind of new to them. And the premise is that you can have good health insurance and you can have good health care and you don't still have good outcomes because of the social determinants. So they list them here, and like one of them, of course, exposure to environment and stuff. Well, imagine what the health is for the children in Flint, and poverty and education and being around people who smoke, and then you grow up to smoke. And so this is very interesting. I apologize for the print being so small. Of course, it was a PowerPoint, so we could read it on the screen. And I'm very disappointed on one of the pages because I can't read it at all, but my notes say 50% improvement in longevity if you do these things. I'm going to go home and get a micro thing. But these are things that typically when you're talking about insurance and programs and stuff, you have to consider the total impact to individuals in terms of health outcomes. So, and then I have for the new members, I also have something on board works. Remind me to give you that. And then I have a little report on the Citizens Advisory Council. They are very interested in the NICS policy and legislation and policy committee. And so they've been added to the distribution list and they may come to the meetings. And Nick is going to talk to Lori about being on the agenda. So they're very interested in working with us to advocate in some way.
Great, thank you. Anyone else? Lori?
I first off want to thank Dave for asking me if I would do, or however I got appointed to this, for that new person served advisory council, along with Lori. I think we were both impacted very high, just blown away on what our purpose is going to be. We just basically had breakfast and kind of got dates. Okay, they'll be at the conferences or trying to come up. And then also, because that did give us the opportunity to meet with Dr. Gordon. And I think there were 7 of us that were present. And for him to take an hour, something of his time, and to listen to personal stories, bringing up the $30 million deficit that we've encountered, I just found it to be an honor and a privilege, and I thanked him highly because he's not an easy person to get to. Mm-hmm. And he listened. I think there were a few tears in his eyes listening to some of the stories and things, and I think we may have an impact on him and what's going to be happening. So
Well, great.
thank you.
We've got 2 good representatives there for us, so thank you for your being willing to participate, too. Anyone else? Oh, good stuff. Is there anyone from the public that would like to address this board? This is your opportunity to speak to us. You have 5 minutes.
Hi, I'm Lori Doyle. I'm the Peer Support Coordinator. And I would also like to echo Lori's sentiments. It was a really good session, and I felt like he was very touched by the stories too. And I'm honored to have been recommended for this, so thank you. And I have a peer here tonight, Karen Smith, who's going to be sharing her story, and her program supervisor, Marianne Frazo, would like to introduce her.
Thank you.
Hi. Well, I have the pleasure tonight of introducing one of First North's certified peer support specialists, and she'll be sharing her story with you. Before I do that, I'd like to provide just a little bit of background information. Karen came to First North in 2012, 7 years ago. And from the moment she came, she shined throughout our program. Karen started a group. She facilitates an Embrace Recovery group every week at First North, and the consumers absolutely love her. I don't think that we have another group at First North where individuals show up so consistently in the longevity of the group. She's kept it going for so long. Karen has taken her group and other individuals to the DIA, to the Walk a Mile in My Shoes rally in Lansing, I'm sure of 2 years in a row. She organizes monthly lunches with the people in her group, one of which a member of her group had never even gone to a restaurant and eaten out before coming to Karen's group. Karen is an NA sponsor to several individuals and participates in NA open talks all over the state. Karen participated and assisted me as co-host during our First North Talent Show. She organizes and manages the garden club at First North as well. Some of the best tomatoes you've ever seen. Karen got her bachelor's degree from Baker's College and was on the dean's list. Karen is an amazing person, and she is respected and loved by colleagues and our individuals at First North. Karen Smith.
I was like, wow, who's she talking about? Hi, everybody. I'm Karen, and I'm honored, and thank you for allowing me to stand here. I'm honored to share some snippets of my story. For those who don't know what a peer support specialist is, it's someone who's faced a lot of dilemmas, who've been treated for some mental illness, and who have they're in the recovery process and able to give back to other people what was so freely given to them. Quickly, 5 minutes, I'm trying to get this quickly. At a very young age, my illness started, I'll put it like that. My illness started at a young age from being called, I'm talking about in the 70s and late 60s, being called Oreo, half-breed, this and that and the other, because I'm from a biracial home. My mom is Caucasian and my father is black. I mean like black, like this. And so I grew up in that era where I had to become whoever and wherever that I would be accepted, because I was tired of fighting. My mother was tired of taking me back to school. So what happened was, as a result, at that young age of probably 14, I ended up finding a way to numb my feelings, and it was through drugs and alcohol. And on July the 30th of this year, I celebrated 30 years clean from no substances, period, in a row. And I ended up doing a lot of peer support work in Wayne County and different counties before I came to Macomb County. It was just called other things. Like Marianne said, it was sponsorship in Narcotics Anonymous. I sponsored 15 young ladies from all over the world, and we do a lot of therapeutic stuff with that. But my job, First Resources North, I came there as a result of meeting supervisor, Mr. Greg Hughes. He was my, not supervisor, he was my first psychology teacher at Baker University, at Baker College, and he said, hey, we might have a position for you. I would love for you to join our team. And I said, well, what would that be? He said, peer support. And I was like, okay, well, I could try it. Let's see what's going on. Okay, so in order to be a peer support specialist, you have to be state certified. You have to take a test. In front of peer support, it's fairly new, but it's the hottest thing smoking, because this is the way you can share your experience, strengths, and hopes, and you can help another individual that needs services provided to them to get through, navigate through pain, navigate through all different type of mental illness, and you're listening, just listening, and kind of grabbing their hand and say, hey, I had that happen to me. Can I tell you what I did? And it might happen for you. And then I ended up coming and having a interview at First Resources North, and the amazing team of professional clinicians that are there. It's like I worked at Chrysler for 18 and a half years. I was the EAP rep, an alternate, that's employee program assistant. Okay, in First Resource North, we have the most amazing interdisciplinary team of case managers, therapists, peer support specialists, psychiatrists, and supervisors. It's like it's just amazing that we all, they have an open door policy, because when you're dealing in mental illness and you've dealt with mental illness and you're in recovery from mental illness, I could be listening to one of the consumers or one of the individuals we serve, and it could bring up some feelings that happened to me. So what do? We got the best supervisors and group in the world. I could walk them to the lobby, and I'll run in Mary Ann's office and sit there and cry or whatever, because they're the most amazing team. And what we do there, and what I do for my personal recovery, because recovery is like an education without a graduation. You don't graduate. There is no cure. One day at a time, sometimes 1 second at a time, a minute at a time. I have to always be on top of what I call it the exact nature of what I'm feeling, so I can know, and I can call Lori, or I can call one of my peers, and I can say, hey, I'm feeling this way, and I need to talk to you because I have a consumer that I'm getting ready to have a face-to-face session with, and I need to be okay. And that's the beauty of having so much support at First Resources North, and I'm sure at all the other facilities. So I kept, I had a lot of racing thoughts. I had a lot of, I would even talk to my thoughts as a kid. I would answer my thoughts. So I could remember when I heard my father arguing with my mom, and I was in the room, he said, I told you we should have took her to a nut doctor years ago. And that tore me up. So what it did was keep me from going to the nut doctor, okay? But when I didn't leave 5 minutes before any miracles happened. I end up going to see a doctor, a psychiatrist. I end up doing everything that it took. I end up staying clean because I was what you call co-occurring, dual diagnosed. I would drink like crazy to numb the feelings of the mental illness, and vice versa. I would act a certain way to get drunk. It was just an ongoing vicious squirrel cage for me. So what I did was, July the 1st, 1989, I made a conscious decision. I had a husband and 2 children, and I looked at my children, and I made a conscious decision that I would never have another drink in my life. I said, I'll never have another drink in my life. And you know what? If I can do that, this is my hope and my promise and my suggestion to the people we serve, that if you know my story and where I've been through to get where I am today, that you or anybody else can do it. And the blessing is that we have some individuals that has ongoing services that's been my consumers probably 4 years, a couple of them, right? And the blessing is not to me, but to them and to the entire team at First Resources North. We got people that have not used any drugs anymore. We have people that are responsible and productive members in society now that literally go to work. We have people that never been to restaurants, and I'm not tooting my horn. Who I'm tooting is Macomb County Community Mental Health, because we have consumers that literally go to work and keep a job. So I know it's about my time. You better tell me, because I'll talk to tomorrow if you don't. Marianne would tell you I will go on and on because I'm excited about recovery. I'm excited about our consumers. I'm excited about being able to share my story, just a snippet of it today, to let you know that what we're doing here in Macomb County is just amazing. And lastly, I just wanted to say that if it wasn't for the people at community mental health that I work with, they've gotten me through a lot of things. I recently had a son that got carjacked in Detroit. He was all over the news, and he was shot 7 times. And, you know, through the grace of God, he's fine. You know, his wife was in the car with him. And, you know, I was able to go in the office. Some things are personal. I don't want to talk about, you know, because the first thing, ain't no telling what somebody might think. But I feel so comfortable to go in one of my co-workers' office and say, guess what happened? You know, to get me through the day so I can better provide services to the people that clerical call and say, Karen, she's here, Karen, he's here. You know, I have clients, a lot of consumers, and I'm grateful to be able to give back what's so freely given to me. Thank you.
Thank you very much, Karen. Is there anyone else that would like to address the public? I mean, from the public who would like to address the board?
Hard to follow up on that one. Thank you again for sharing your story. For those that don't know, I'm Sean. I'm with CEO. I'm here to give the annual report, the monthly, I should say. I'm sorry. For our individual served update, CEO hosted a active shooter seminar at Clinton Township location. The Clinton Township Police Department brought a PowerPoint presentation under the name of Alice to train our employees on how to stay safe and the steps to take in the event of someone entering a location with a gun. The seminar was very informative and had over 20 employees present. The individual served monthly educational was on choking safety. For our community center update, our Clinton Township location, we will be having a Halloween party on 10/31 with trick-or-treating throughout the building for the individuals that wish to participate. We are in the process of establishing Clinton Township clubs that the individuals can participate in. At our Anchorville location, we recently held a vendor show and raised over $400 for community outings and supplies. We also received a donation from Meals on Wheels. We have a Spirit Week coming up scheduled for the week of Halloween in anticipation of the Halloween party. And also at our Anchorville location, we've had 9 new individuals start in the last month and 7 tours on top of that, as well as me and several of the other individuals have been working on the micro business like we do every month, and we have more pens and pads for anyone. At our Mount Clemens location, we received a donation from Meals on Wheels, and in preparation for Halloween, most of the individuals went to the movies and seen the Addams Family movie. We are having a fundraiser on Monday, the 28th, at Buffalo Wild Wings at Mount Clemens. There is a coupon attached at the bottom for anyone who would like to go. At our Washington location, our individuals served ran a micro business during Anchorville's vendor show and raised over $60 in merchandise sold. They also delivered over 100 meals to seniors within the last month. For our stakeholder update, each location is installing smart TVs to display all of the places and activities we visit when we're in the greater community. This will help individuals that tour our locations to be able to see and understand all the available activities we offer. CEO's employment retention rate for September of 19 was 96%. And as a final closing notice, well, we have received our dates for CARF. They are coming early December. And that is all for this month. Thank you.
Thank you, Sean, for the update. Anyone else from the public? Please state your name, and you have 5 minutes to address this board.
Good evening. I need to think for a second. I heard a lot. My name is Robert Blumingberg. A lot of people tell me I should come up here and talk to the board. I have in the past. There's a few new faces since the last time I was here. That's probably a good thing. I'm kind of speechless for a second, just because this young lady over here kind of she brought up my point that I'd like to make. I have a brother with cerebral palsy who I take care of, and he's been receiving support from Macomb County Community Mental Health for a lot of years, probably 19 years now. He's been getting community living support through self-determination for about 10 years now, and for the first few years, everything was really fine and dandy. Everything was great. In fact, Macomb County Community Mental Health was like the shining light in Macomb County as far as departments within the county, I think. However, there was funding cuts, and Tony, I don't think you were on the board the last time I addressed the board, and I've talked when John Kinch was here. I made a couple of speeches at a couple of different things that he held. I've talked to Phil before, and I've talked to Brian as well. And as far as my brother goes, I know that Dave and Adam are going to take care of my brother's issues personally. They've said that they will, and I trust them that they will. But I don't think that you guys really realize the effect of the funding cuts for this department. I'm like fuming right now. When Tony comes up with the idea of, let's do a millage, I said that 2 years ago. I sat here in front of you guys and said, why don't you guys come up, a half mil would cost me like $70 a year, but it would bring back every penny that you guys lost because the state cut the funding for Macomb County Community Mental Health. Okay, and so Brian, you can sit there and shake your head, but I sit over here, and when I saw Tony make that statement, and I see half the people on the board just objectively shake their head like, no, it's not going to happen. Like, what are you guys talking about? It's not going to happen. The only way that Dave is going to be able to do his job, and Adam is going to be able to do his job, and all the ladies that work with this lady over here, and the supports coordinators and the case managers, and all the people in community mental health can do their job and be successful at it, is if you give them the tools to do it. And that's money, okay? These guys are they've been operating for decades under one budget, like, overview, and then they get another one that's totally opposite to that. And so I'm sorry, I'm a little passionate right now, I'm a little fired up, and I'm trying to be positive. But has anybody from this board ever gotten together a group of supports coordinators or case managers and talked to them about what they think should happen within Macomb County Community Mental Health? Do you know what it's like to be a supports coordinator? And they only work 37 and a half hours a week, but they have to take care of 50, 60, 70 consumers, okay? And they have to do an hour a month or more FaceTime with these consumers, and then they have to do the paperwork on top of it, okay? And they keep, they're over the years, they've been giving more and more caseload and less time to do it, and more paperwork that they have to do. And the reason I'm here is because for the last 5 years, there's been paperwork issues that have screwed up my brother's authorization on just about every authorization, okay? Dave and Adam and I talked this week about my brother's authorization. The only reason that this happened is because his supports coordinator is so overtasked, and that every supports coordinator is so overtasked that they don't even notice their own mistakes, okay? And so my brother gets, and fortunately for my brother and fortunately for me, he gets very good support. He gets 133 hours a week of community living support, okay? But his supports coordinator was so overburdened at the time, when she put in his authorization, she didn't notice that she put it in as 133 units, okay? And so because everybody is overburdened, nobody noticed it for 8 months, okay? And as a result, my brother's staff had to take a pay cut effective May 1st. And it's now October 22nd, and my brother's staff has still not gotten their pay cut back. And I keep hearing from everybody, oh, don't worry about it, it's going to happen. We went to a local disputes resolution. We did everything legally possible to make this happen. Yet still, October 22nd, here we are, and I've talked to everybody within Macomb County Community Mental Health that has the ability to facilitate positive results for my brother's case. And everybody tells me that it's going to happen. But still I'm here, and it hasn't happened. And the only reason it hasn't happened is because of what Tony said. You guys need money. How can you not take a look at a millage? How can you abjectly shake your head at the possibility of a millage, okay? Get with Andre Druzzi, okay? He wanted to put together a millage for a jail. Why can't we put a jail and a millage for community mental health together? Let's be creative, okay? We have to come up with $30 million, or I think it's like more like $40 million. And if you add the cost of living into that, it's probably more like $50 million today compared to 2013 dollars, okay? And so I know that you guys can't feed back to me. And so what I want to know is that, like, everybody is on the board for a different reason, and everybody is in this audience for a different reason, okay? But what I want to know is, like, what is your greatest accomplishment for being here, okay? I know what my greatest accomplishment is. It's I've given my brother the ability to live. He's 68 years old now. He has cerebral palsy. His body doesn't work very well, but his mind does, okay? He's a very articulate guy. He's funny. He gets out in the community. Everybody who he interacts with, he positively affects. Okay, but his body needs 24/7 supervision. Okay, and because of Macomb County Community Mental Health, we've been able to keep my brother in his own home. He gets to keep his dogs. He's got his own yard. I got a van for him that he can go and do whatever he wants. And he's got assistants that can do the things with him that he needs to do and wants to do. Okay, and there's so many other people like that over the last 4 or 5 years have lost their support. And the people that advocate for them have given up. They give up, okay? And so I can't give up. Not for myself, not for my brother, not for the other people like my brother, not for the people in Macomb County Community Mental Health, because over the years I've developed good friendships with a lot of people in the different departments. It just happens that way, okay? And so when you guys drive home tonight, you have to ask yourselves, what is your greatest accomplishment for being in this room right now? Okay, you've noticed there's a large demographic of people in Macomb County that get support from Macomb County Community Mental Health or have the ability or the need or qualify for it or however we want to put it. And so you guys are responsible for the well-being of a lot of downtrodden people in Macomb County. And so how can you abjectly just shake your head at any opportunity to get additional funding to take care of the consumers as well as the staff, okay? You can't teach people compassion, okay? The social workers that work within this department, they're so compassionate. You can't teach that in a school, okay? But how can you be compassionate if you haven't gotten a pay raise in years and you can't even take care of your own family?
Robert?
5 minutes is up?
Yeah.
Okay.
Did you want to say anything in
just,
summary?
I just hope that what I had to say has some effect in the future, because unless something drastic happens like the last time, I'm not going away, okay?
Thank you.
I'm not trying to be an advocate. I'm trying to, I want to work with you guys. I have a lot of energy and a lot of, like, you know what, some people wake up in the morning and they want to go golf. I wake up in the morning and I want to help people, okay?
Right.
And so you guys on this board, when you wake up in the morning, what is your first thought? I know everybody has different things in life, but when you're on this board, you know what? There's 10,000 consumers in Macomb County that you guys are their one and only, okay? You guys wake up and you got a bunch of people in your lives, okay? But for 10,000 people in Macomb County Community Mental Health is their one and only.
Thank you.
Okay? I'll get back my time.
Anyone else from the public? Anyone else? Seeing none, we're on to item number 14, adjournment, and this meeting is adjourned at 7:05 p.m. Thank you to everyone who is here and who participated. Appreciate it.
All right, the meeting's over. Let's go.